You know that feeling, right? That sudden, sharp pain in your chest that just stops you in your tracks? Your mind immediately starts racing. It's actually a pretty common experience, but that doesn't make it any less scary. So let's get into it and figure out what might really be going on. So you feel that pang, that pressure, and bam, the big question hits you. Is this just some really bad indigestion, or is it something way more serious, like a heart attack? It's one of the most common medical questions people have, and knowing the difference, well, it's absolutely crucial. All right, so here's our game plan. We're going to start by unpacking this whole chest pain dilemma. Then we'll look at other things besides your heart that could be causing it. After that, we'll dive deep into the signs of gas-related pain and compare them directly with the signs of a heart attack. And we'll wrap it all up with a critical action plan, so you know exactly what to do when every single second counts. Okay, first things first, let's get one thing straight. Chest pain itself isn't a disease. Think of it more like a signal. It's your body's alarm system telling you something's up. And that something could be anything from a minor annoyance to a life-threatening emergency. And here's something that might help you breathe a little easier. When you feel that pain, your brain might immediately jump to heart attack. But hold on. Your chest is some pretty crowded real estate. It's got your lungs, your esophagus, muscles, ribs. The heart is just one of the neighbors in that area. So if it's not always your heart, what else could it be? Let's take a look at some of the most common culprits behind chest pain, just to get a broader picture. And you might be surprised by the lineup here. I mean, of course, we're focused on gas versus a heart attack, but it's good to know that something as simple as pulling a muscle, or a lung issue, or even a really bad anxiety attack can set off that very same alarm bell in your chest. All right, let's kick things off with the really common and usually much less severe cause, gas. This is a classic case where the problem isn't really in your chest at all. It's actually starting down in your digestive system. So what's actually happening inside your body? Well, think of it like this. Your stomach produces some seriously strong acid to break down food. And normally, there's a little valve that keeps that acid right where it's supposed to be. But sometimes that valve gets a bit lazy, or maybe you've just got too much acid and it splashes up into your esophagus. Your esophagus just isn't built for that, and that irritation, well, that's what you feel as burning chest pain. Okay, this is where you get to play detective. Your body is giving you clues. First, what does it feel like? Is it a sharp, burning sensation? Second, when is it happening? Right after a big meal? Third, and this is a huge clue, what happens when you move? If you sit up or stretch and the pain gets a little better, that's a good sign it's not your heart. And finally, where is the pain? With gas, it usually stays put. It doesn't travel down your arm or up to your jaw. Okay, let's shift gears. We have to talk about the really critical one, the heart attack. This is a true medical emergency, and the symptoms you'll see are very, very different. You see, unlike gas pain, which is all about acid irritation, a heart attack is more of a plumbing problem. One of the arteries that feeds your heart muscle with blood gets blocked, usually by a clot. Suddenly, that part of the heart isn't getting any oxygen. The muscle tissue starts to get damaged, and that damage is what causes that intense pain. Now, the red flags for a heart attack are on a whole other level. Forget sharp or burning. People describe this as a heavy, crushing pressure, like an elephant is sitting on their chest. And unlike gas pain, moving around does absolutely nothing. The pain is constant. And here's that classic sign. The pain travels. It radiates out from the chest, down the left arm, up into the neck or jaw. And finally, you could drink a whole bottle of antacid and it would do absolutely nothing. And the pain is often not the only signal. A heart attack is a full-body crisis, so it can bring on other terrifying symptoms. You might break out in a cold sweat, suddenly find it hard to breathe, feel nauseous, and there's often this overwhelming feeling of anxiety or just pure dread. These are major, major red flags. So we've looked at both of these scenarios on their own. Now let's put them side by side. This is where the differences really become crystal clear. Okay, pay close attention here, because this is probably the most important part of our entire discussion. Let's run through it. The sensation. Is it a sharp burn or a heavy squeeze? Positional change. Does moving your body affect the pain at all? Does the pain spread or does it stay in one spot? And finally, do antacids help? A simple yes or no here is a massive clue. Answering these 4 questions can give you a much, much clearer idea of what you might be dealing with. Look, understanding the difference is one thing, but knowing exactly what to do in that moment, That's what can save a life. So let's turn all this knowledge into a clear, concrete action plan. So if the symptoms are really pointing towards gas, it's a burning feeling after you ate, it gets better when you sit up, the usual approach is pretty straightforward. You can take an antacid to deal with the acid that's already there. Other medicines can help reduce acid production in the future, or break up gas bubbles to relieve that bloating feeling. And right here, this is the most important question of all. What if it's not so clear-cut? What if you're just not sure? Because the risk of being wrong is just too high to gamble on. If there is any suspicion, any at all, that this could be a heart attack, you act immediately. Step 1, sit down. This takes strain off the heart. Do not let the person walk around. Step 2, aspirin. If they're able to, have them chew 1 300 milligram aspirin. Chewing it gets it into their system faster, and it can help thin the blood. And step 3, this is absolutely non-negotiable. Call for help. Get emergency services on the way, right now. And here's a number I really want you to remember: 20 minutes. If any kind of severe, unexplained chest pain goes on for more than 20 minutes, you have to treat it as a medical emergency. Don't wait. Don't try to tough it out. Make the call. So if you take only one thing away from all of this, let it be this golden rule. It is always, always better to be the person who went to the emergency room for a bad case of heartburn than it is to be the person who stayed home during a heart attack. Never, ever risk it. When in doubt, get it checked out. When it comes to your heart muscle, every single minute counts. Getting treatment fast can be the difference between a full recovery and permanent damage, or worse. So now that you have this information, the real question is, are you prepared to use it?